Hello, everyone. Thank you for joining us today for this webinar on rodent anesthesia and surgical monitoring. We're going to discuss how to prioritize animal and researcher safety and well-being. Throughout this webinar, we're going to go over the requirements for successful surgery, an overview of different anesthetics, as well as some of the animal side effects with these agents. We'll also discuss why it's important to incorporate a surgical monitoring device into your surgical suite. Then we'll shift gears a little bit and talk about some of the user risks associated with volatile anesthetics and how to manage those risks. But just before we get going, I'd like to draw your attention to the bar at the bottom of your screen. If you're having any trouble with the webinar audio or video, please click the chat button and you can speak with someone on our team and they'll help you sort that out. Also, if you have any questions throughout the webinar, please feel free to hit the Q&A button and submit your questions that way. I'd like to start off quickly with a poll here. So my questions for you are, what animal models are you working with? Are you using mice, rats, other rodents such as rabbits or guinea pigs, zebrafish, or even large animal models? And my second question is, what type of surgical procedures are you involved in? So are you working with vascular catheterizations, more soft tissue work, neurological or cardiovascular procedures, or device implants such as telemetry, or other? And if you select other, please feel free to type your answer into the chat window. Good, there seems to be a good mix of different animal models and procedures here. Just waiting on our last few. Perfect, thank you. Okay, so let's discuss some of the requirements for successful surgery. It's important to have pre-surgical planning in place, so this ensures that you have the supplies, personnel, and protocols ready to go prior to starting any sort of surgery. Training is also very important. You want to ensure that staff is trained in asepsis, gentle tissue handling, hemostasis, suture techniques, and a variety of other techniques. During the procedure, you need to ensure appropriate anesthesia and analgesia, and this can be done using a gas or injectable. If you're working with an injectable anesthetic, you also need to factor in the dosing, and you should calculate that prior to starting a procedure. And you also need to provide appropriate pain management. During a protocol, it's also important to monitor the animal. So you'll be assessing anesthetic depth and physiologic conditions such as body temperature, cardiac, and respiratory rates. Following a procedure, post-operative care is essential. So things like thermoregulation, electrolyte and fluid balance, looking for behavioral signs of pain, signs of infection, and then removing skin sutures, clips, or staples at the appropriate time. When you choose an anesthetic agent, you have many options. Volatile anesthetics include isoflurane, sevoflurane, and halothane. These all require an appropriately calibrated vaporizer. Isoflurane and sevoflurane also require active gas scavenging, so you want to make sure you have passive or active system in place to scavenge the waste gas. Isoflurane has a quick recovery time of approximately 1 to 3 minutes, but is associated with respiratory depression and it may necessitate external ventilation. It also has little hepatic metabolism. Sevoflurane is very similar to isoflurane, but it has a lower blood gas solubility, so you'll see an even more rapid and induction and recovery. So within that 1 to 3 minute window, it may be closer to 1 or 2 minutes. Halothane does have significant hepatic metabolism, and it may also precipitate cardiac irregularities. Like isoflurane and sevoflurane, though, it does have a fast recovery time. For some procedures, volatile anesthetics are not appropriate and you'll have to use an injectable agent. The commonly used cocktail is a mixture of a dissociative anesthetic like ketamine coupled with an alpha-2 agonist. So this will provide appropriate sedation and analgesia. However, if your surgery is greater than 20 minutes in duration, you may need to consider an additional dose. The difficulty with this is that there is a risk of severe cardiac depression. Sodium pentobarbital is also another injectable option. It's a barbiturate, and it does have poor analgesic properties, so you have to consider pain management when you're using this agent. Unfortunately, it does have a narrow safety margin and a prolonged recovery period. It's also a controlled drug, so it may be a little bit more difficult to work with sodium pentobarbital. Lastly, urethane can provide long periods of anesthesia with little respiratory depression. However, it is a carcinogenic agent, so it's not suitable for recovery surgeries. So as you can see with injectables, there's a lot of things you have to consider, and some agents are just not suitable if you're working with a recovery type of procedure. When we compare the two, there are several benefits to using inhalant anesthesia. So an injectable can be difficult to choose your initial dose. Animal species and weight and duration of the procedure all have to be factored in. With an inhalant, it's generally a standard range for induction and maintenance, and it's very easy to adjust. Further, with injectables, there's a risk of an overdose during a procedure, especially a prolonged procedure. With an inhalant, fast and easy removal almost eliminates this risk. Injectables are also associated with prolonged recovery, whereas we saw inhalants like isoflurane, a recovery time is very short. It's often only 1 to 3 minutes. Injectables also do not offer depth modulation, whereas working with inhalant anesthesia, you can modulate the depth very easily with the turn of a dial. Lastly, there's always the risk of a misplaced injection into an organ, whereas that's clearly not a risk with an inhalant anesthesia. So once the animal is anesthetized or given the anesthetic agent, they'll move through the different planes of anesthesia. So in plane 1 and 2, you'll see that they're starting to lose some reflexes. However, there's no amnesia or analgesic effects at this point. It's not until plane 3 where you have intercostal muscle paralysis, as well as progression to complete amnesia and analgesia, that it's safe to begin a procedure. So with all anesthetic agents, there are side effects for the animal. Central nervous system depression is very common. It's common to the point of loss of consciousness. So if anesthesia is too deep, the animal may even lose respiration. Isoflurane works by inhibiting voltage-gated sodium channels to depress glutamatergic neurotransmission in the hippocampus. Cardiovascular depression is also a side effect with anesthetic agents, including isoflurane. This manifests as decreased myocardial contractility, decreased stroke volume, and you may also see a decrease in systemic arterial pressure through a reduction in total peripheral resistance. Agents such as isoflurane and sevoflurane inhibit respiratory control systems. So this may manifest as inhibition of feedback control of central respiratory centers, inhibition of chemoreceptors, pulmonary reflexes, and neuronal input. Altered oxygen supply and carbon dioxide elimination can also cause an acid-base imbalance. And this is the most likely emergency situation, this respiratory depression. It's very common with a volatile anesthetic, which makes monitoring essential. So I'd just like to draw your attention to a study by Cesarovic and colleagues, and it highlights the prevalence of respiratory depression. They used female mice for this study and took arterial blood samples from the carotid artery at 10, 30, and 50 minutes under anesthesia. And they assessed acid-base balance, so pH, the partial pressure of carbon dioxide, which is the PCO2, and standard bicarbonate. And they used a blood gas analyzer to do so. So if I can draw your attention to the graphs on the right, the y-axis, you have pH in the first one, partial pressure of carbon dioxide in the middle, and then standard bicarbonate on the bottom. And then along your x-axis, you have time under anesthesia, so 10, 30, and 50 minutes. If you see the hatched bars here, these are the normal ranges for each of these parameters. The dark boxes are the isoflurane, and the lighter boxes are sevoflurane. And as you can see, for example, in the pH, the normal range is between 7.45 and 7.4 approximately. This is altered at all points under anesthesia. Similarly, partial pressure of carbon dioxide is altered at all points, and bicarbonate is also outside of those standard ranges. Loss of temperature control is also another very common side effect with anesthetics. Agents inhibit temperature regulation centers in the brain, as well as inhibiting shivering. And since rodents have a low body mass and a high surface area, they're much more susceptible to hypothermia. Once the animal is hypothermic, then there's also a host of other side effects that may manifest. This includes arrhythmia, increased recovery time, and even an increased risk of infection. This is associated with vasoconstriction and impaired immune function. So it's essential to supply controlled heat and monitor animal body temperature throughout a procedure. Just to highlight the importance of temperature monitoring, I'd like to show you another study here. So in this case, rabbits were anesthetized with ketamine xylene, and then they were followed with intubation and maintenance on isoflurane. Temperature was recorded every 5 minutes with an esophageal temperature probe. So if I can draw your attention to the graph on the right, your x-axis is time in minutes under anesthesia, and then the y is temperature in degrees Celsius. You'll note that the little triangular line here is animals that did not have a heating device. So you can see that steady decline in temperature throughout the entire 45-minute period, compared with animals that had a forced air warmer or a warm water blanket. Temperature was maintained. So it's very, very important to provide controlled heat to your animals throughout a procedure. So let's talk about why it's important to incorporate a surgical monitoring device into your surgical suite. The first reason is that it can help you streamline documentation to meet your institutional animal care and use committee requirements. According to the Guide for the Care and Use of Laboratory Animals, it's necessary to evaluate anesthetic depth, body temperature, cardiac and respiratory rates with appropriate documentation. Some additional benefits of this monitoring include more stable preparations. It also enables you to identify problems and abnormalities sooner, and therefore you can intervene quicker. It helps improve surgical consistency, and it improves survival rates as well. Another reason to incorporate a monitoring device is that it can enable a single researcher to perform procedures and eliminate scheduling conflicts. Since it's necessary to document all of these parameters such as respiration, body temperature, and heart rate, you often have to have a second person in the room with you who can assist you and monitor these parameters and document them while you're performing a surgery. Using a monitoring device can reduce the personnel required because you can have the device in place of the person. Some things to consider though, if you're looking for a monitoring device, are parameters and controls. So what you are in fact able to set and control with the device is important. Having alarms, some systems enable you to set a certain range for parameter. So for example, heart rate. If the animal's heart rate exceeds a certain window or a range, you can have it programmed to give you an audio and visual alarm. And this is excellent because if you're working alone, you may be very focused on what you're doing and not really be thinking about monitoring and looking up at the screen, but an alarm can alert you and make you pause and assess the situation and intervene if required. Other features to look for include screenshots So if you're doing something very time sensitive, being able to simply snap a picture of all these parameters is very handy, as well as data storage and export. Depending on the type of work you're doing, you may want to go back and analyze data, or you may just want to have records. So being able to export these recordings and files is very important. Perhaps most importantly, incorporating a surgical monitoring device can enhance animal well-being. So we know it's important to assess the depth of anesthesia through respiration. Monitoring temperature is also important to prevent hypothermia because of the hypothalamic depression. And even things like hair clipping and cold delivery gases or an aseptic prep can evaporate and cool your animal. So it's very important that we prevent hypothermia. Incorporating a device also allows you to identify abnormalities and intervene. This could be something like an ECG abnormality or a change in heart rate and respiration if there's inadequate anesthesia. And since our goal is to care for our research animals, being able to spot these problems sooner and intervene is ultimately in their best interest. Lastly, using a monitoring device can improve recovery rates. My last reason here that it's important to incorporate a surgical monitoring device is that it can enhance surgical outcomes and help you generate high-quality models of disease. And what I mean by models of disease is there's tons of different procedures in place to develop a certain condition in an animal that you can then study. So something like heart failure through transaortic constriction, coronary artery ligations, ischemia reperfusion models, even working with telemetry implants or xenografts. Monitoring your animals during these procedures can help you ensure that you've performed the procedure correctly and you've achieved the result that you were hoping for. So we actually have an excellent example of this. These screen captures are courtesy of Dr. Mary Lindsay at the University of Mississippi Medical Center. So what you see on the screen is she's taken actual screenshots from her monitoring device during a procedure. The image on the left was taken prior to a left anterior descending artery ligation. So she's monitoring ECG lead 1, 2, and 3 in this case. And then the second image on the right was taken 5 minutes post-ligation. So you can see just by looking at these two images, the alterations in the ECG signal between the two. So having this ability to quickly take a screenshot and to monitor these parameters during a procedure can help ensure that you've achieved the result you're hoping for. And just from looking at the two, we can see the difference, a very clear difference in the ECG signal. Okay, let's switch gears a little bit. We've talked about why monitoring is important for your surgical animals, but let's talk about the user risks associated with anesthetic agents. This is often overlooked. Unfortunately, as some of you may have experienced, short-term exposure to inhalants, so things like isoflurane, can cause eye irritation, headache, skin irritation, cough, sore throat, drowsiness. There are central nervous system and cardiovascular effects. And the risk during pregnancy and the effects on the developing fetus are actually unknown at this point. However, despite all of these side effects, there are currently no occupational exposure limits. It's only recommended that you don't exceed 2 parts per million over 1 hour. And this can be very difficult to monitor. I don't suspect many labs are monitoring the exposure. So this highlights the importance of anesthetic waste gas scavenging. So what you see here is a basic anesthesia system setup. On the left, you have a vaporizer and flow meter, your induction box below, the animal nose cone on the right, and then on the bottom here, we have an exhaust unit and a filter. So depending on your setup, you may have something very similar. A lot of people only work with the charcoal filter, and what that does is it passively absorbs the waste gas from the system. But if you incorporate an active scavenging unit, you can do more to protect yourself and others working with the system. And the way this works is that you have your anesthetic gas flowing from your vaporizer and flow meter through a valve. to your induction box. So you have your animal in, gas flowing, and the system is designed so that when you crack the lid a little bit, it activates your exhaust unit, and it's going to pull all the unbreathed gas out of the induction box through the unit into the filter. So when you actually open the lid all the way, you don't have that big burst of isoflurane in your face. You then switch the valve over to the nose cone. So when the animal's anesthetized, you switch your valve, move them to the nose cone. And similarly, you have anesthetic gas from your vaporizer and flow meter traveling to the nose cone to maintain the animal. But if you can see here, this outer ring on the nose cone is actually the scavenging ring. So this is connected to your exhaust unit, and it's pulling all the unbreathed anesthetic gas through the unit into the filter. So you have gas flowing to the animal, but anything they're not breathing is being pulled away from your face. Another really simple solution to enhance safety in the lab is using a key fill. Some labs may have this, some may not. So if you're familiar or you're working with isoflurane, it's provided in bottles like this. And there's a very special little connection on the top of the bottle. The way the key fill work is that it's notched in a way that it will only fit on an isoflurane bottle. This prevents you from connecting it to the incorrect agent and putting the incorrect agent into your vaporizer. So this is the only one that will fit on your isoflurane bottle. Similarly, at the other end of the key, it's notched here to allow for filling, and these notches are specific to isoflurane vaporizers. So you can't accidentally put the wrong key into an iso vaporizer and put the wrong agent in. This is the only configuration that will work. Working with a key is a very simple way to prevent spills and exposure, to ensure the appropriate agent is dispensed into the vaporizer, and ultimately it contributes to less waste because you're not spilling this all over the place. Okay, I have one last poll for you. I'm curious to know what tools your facility uses to ensure technician and investigator safety. So if you know, are you working with an active anesthetic scavenging system? So something that's actively pulling the unbreathed gas? Do you have a passive system, just a charcoal filter? Do you work with a key fill for your vaporizer? Or are you unsure what's available to you? Excellent, just waiting for a few more. It looks like many of you are working with a passive system, which is great. Obviously, an active scavenging system is ideal, but at least you're using something. And I'm happy to see that some people are working with a key fill. That's great. All right, thank you. So let's go over what we talked about today. We discussed how successful surgeries require planning, training, appropriate anesthesia and analgesia, as well as surgical monitoring and post-operative care. We discussed how volatile anesthetics, including isoflurane, are safer and easier to administer than injectables. Now, this is obviously dependent on the type of procedure you're doing. In some cases, an injectable anesthetic is the appropriate choice. We talked a little bit about how surgical monitoring ensures animal well-being, increases consistency, and helps you adhere to increasing institutional animal care and use committee requirements. Lastly, we went over some occupational risks with anesthetic agents and how these are often overlooked, and there's very few guidelines surrounding user safety. This highlights the importance of waste gas scavenging to reduce user exposure. So to summarize for today, surgical monitoring devices enable rapid assessment and documentation of multiple physiological parameters. Live monitoring enables investigators to intervene quickly to ensure animal well-being and accurate surgical outcomes. These devices also streamline documentation and can be used to provide evidence of protocol adherence and good surgical practices. In addition to animal well-being, user safety is an important consideration, and using active anesthetic waste gas scavenging can reduce exposure. Thank you so much for joining us today. If you'd like to learn more about Scintica, you can visit us online at scintica.com. You can also reach us by phone or email. And we're just going to take a couple minutes now to go over some questions.
Excellent. Thank you so much, Michelle, for that awesome presentation. And thank you to everyone in attendance. We've advertised this webinar as a 30-minute event, so we'd like to sort of stick within that time frame. We have a few minutes to answer some questions. Any questions we don't answer now, we'll answer privately and also publish the transcribed results. So with that in mind, Michelle, our first question is, I do cardiovascular work. Will the type of volatile anesthetic I choose influence my results?
Well, that's a great question. The short answer is yes, absolutely. So the main thing you have to keep in mind when using something like isoflurane is hemodynamics. ISO can decrease heart rate, blood pressure, systolic and diastolic function, and this is also concentration dependent. So if you're doing any sort of procedure, especially cardiovascular work, where you're looking at pressure or heart rate, you may want to consider a different agent other than isoflurane. Off the top of my head, urethane can be used, and it can be combined with alpha chlorelose if you're looking to preserve autonomic reflexes. But urethane's only suitable, or this combination is only suitable for terminal procedures. So my recommendation would be talk to your vet, honestly, before you begin your surgeries. Make sure you have a good protocol in place. Talk to a veterinarian, let them know what you're looking to measure, and they can help you decide on the appropriate agent.
Okay, perfect. And that probably answers a few other questions we've got, specifically from Dr. Ravindran about what a suitable anesthetic is for cardiac research. The next question is, how important is maintaining a constant physiological temperature? You touched on it a little bit in your talk, but can you expand on that a little bit?
I think the key word there is constant. So there are many ways you can provide your animal heat during a procedure. There's certain things you can just purchase at the drugstore, heating pads, microwavable things like that, which will work. They will provide your animal heat, but you aren't able to control it as well. And you have to think about the effects of temperature changes on the body. So you're going to have heart rate and blood pressure are going to change, and that'll influence cardiac output. Blood viscosity also changes with temperature. So if you're doing any sort of pressure volume loop work, constant temperature is really, really important. And drug metabolism can also change. Even the anesthetic that you're giving them, the metabolism might change if their temperature swings too much. So it's very important to make sure their temperature is constant, and that's, you can purchase something inexpensive at the drugstore, but you won't be sure that the temperature is constant. So I definitely recommend looking for a device that provides constant temperature.
Okay. For those people who don't have active gas scavenging, do they need to purchase an entire system, or can they just buy the scavenging unit?
So obviously anesthetic systems they're not very cheap. And once you have one in place, it's really hard to switch to something completely different, especially if it's working for you. We do offer the gas scavenging unit separately from a system. So if you're using a vaporizer and flow meter and you have an induction box and all of that, excuse me, you can just purchase the scavenging unit, connect it with tubing to your system, and then it will connect to a charcoal filter, and you can just integrate scavenging that way.
Okay, perfect. We're going to ask a few more questions. We'll go just a few minutes late. And again, for those of you that do need to hop off, we'll make the answers to these questions available after our session. What surgical monitoring system was in the picture that you showed, and can you talk a little bit about its features?
Okay, I assume that this person's referring to the one that Mary Lindsay had sent us screenshots for. So let me just scroll back in my presentation here. Okay. So this is the screenshot from the device. This is the Indus rodent surgical monitor. It is available through Scintica. So this system consists of, what you see in the screenshot is from the tablet, and it's got a wireless connection to a heated surgical platform. So you have core body temperature and the ability to control and maintain the temperature of the platform. So when we were talking about all those parameters that are influenced by body temperature, having a system like this that enables you to control the temperature of the platform is really, really nice. It also enables heart rate, ECG, respiration, pulse oximetry, and they've recently released a vascular and ventricular pressure catheter option. So if you're doing invasive work, you can integrate it that way. But one of the important things about the system is it lets you set alarms. So we talked about being a little bit focused on what you're doing during a procedure and not really looking up at the screen that often. The Indus surgical monitoring system lets you set audio and visual alarms if your animal is outside of certain parameters. It also lets you take screenshots. So that's how we have these from Dr. Lindsay. And you can also store the recording on the tablet and export it to a computer.
Okay, perfect. Let's just ask one more question. And the question is, what signs do I need to monitor during recovery after surgery?
Oh, great. We didn't really talk too much about recovery today. There's obviously several signs to look for. Specifically with rodents, some easy things to look for are changes in gait. If they start to show a bit of a hunched over posture, any sort of changes in appetite or thirst, if they're not eating or drinking, that's a red flag. And obviously weight loss is also a concern. I think the most important thing during recovery though is ensuring that you have staff available to actually check on the animals. So making sure that you schedule, following a procedure, having someone come every hour or two to be able to check in on the animals, look for specific signs, document anything that's abnormal is really, really essential.
Okay, perfect. All right, well, with that in mind, we've extended our session by about 5 minutes today, and just to be respectful of everyone's time, we'll wrap things up now. We will, as I mentioned before, be sure to answer any outstanding questions privately with those of you who are waiting for a response, and we'll publish a written transcript of all our questions and answers from today's session. So look out for a follow-up email over the coming days with links to all these resources, and we hope you enjoyed our session today. I'd like to thank our presenter, Michelle Dotzert, for highlighting some key considerations when planning a successful surgery, like the choice of anesthesia and the importance of surgical monitoring and maintaining a stable research preparation. And Michelle also provided some key user safety tips to minimize risk, avoid exposure to volatile anesthetics, and some important considerations for the lab, animal technicians, and research scientists. Thanks again for attending our session today, and we look forward to seeing you again at a future Scintica event. Have a great day, and thanks again.